The Inclusive Healthcare Partnership Project centers the voice of people with developmental disabilities in saying how they want to receive healthcare information and what information is important to them. So we make sure that all our materials are reviewed multiple times by focus groups of people who experience developmental disabilities.
We're taking this sometimes very complex health information from all of these different sources, and we are putting them into plain language, so a third to fourth grade reading level, and then bringing in illustrations to further clarify that. And a big part of it is taking that information and just organizing it really well, which, as a person who went to cartoon school, although I'm not necessarily creating comics with a lot of this, although that's something we want to do, it is still using those cartooning skills and organizing it in a very clear and concise manner, so that it's much more easily understood.
There's a large self-advocacy movement that's part of the civil rights movement for people with intellectual disabilities, where they can speak up about what they think is important and what they are capable of, and that they can make cases and negotiate for things that they want in their lives.
It's very important to me to make sure that it's inclusive for all people, especially, but also people with disabilities. And plain language is very important, because otherwise we as self-advocates, as a person with a disability, get too much information, and that is too much for us. So it is crucial that we have information that is accessible.
People that have any disability, whether it's developmental or medical disability, to be able to communicate with their healthcare providers and vice versa, so that we are able to effectively provide care, compassionate care, to people that are neurotypical and neurodivergent. Neurotypical would be someone that does not have any developmental disabilities or needs, and does not have any medical complexity. Whereas neurodivergent, there may be needs that aren't necessarily obvious or outward to to the layperson, but perhaps they have a processing challenge, or they have some sort of developmental challenge that makes it a little bit more difficult for them to understand information coming at them.
For a lot of us that do this kind of work, we have to do a lot of unlearning and figure out ways that we can draw upon our visuals and speak in more plain language. And that's an ongoing project for me, and certainly an ongoing project for the Inclusive Healthcare Partnership. And I would actually argue it should be a task and charge for everybody in graphic medicine.
I think comics are just an incredible resource for folks with learning disabilities, folks that are neurodivergent. I am neurodivergent, and I have the easiest time reading when I'm reading a comic, and I love comics that dig in on a particular subject. So I like nonfiction comics. I love graphic medicine. It just always organizes information in a way that makes it easier for me to understand, and also keeps my attention. And I think illustrations are a big way where that can help you keep attention, and also just clarify things that are being said, and help you visualize these kind of abstract ideas.
I think the whole notion of graphic medicine is really important for a whole range of people who may not have English as a first language, or may be more visual learners. And so I think there's a lot of information that's warranted by having visual information, maybe in addition to or instead of words. What do you like best about being part of this project, Jenny?
I like that I'm helping others, and I like that I'm helping even though other people do have a voice, other of my peers do have a voice, I like that I'm helping them, the people who don't necessarily have a voice. I like that I'm helping those people also advocate and talk about what they need and how they can help better themselves for advocacy.